There are side effects from both radiation and chemotherapy. Radiation can cause skin burns. You know, radiation it's being used to destroy your cancer cells, so it has to be strong enough to penetrate the outer tissues, bone, muscle, skin, fat. So it's logical that it's going to do some damage to some of those underlying structures. So you can have some skin burns. There are topical ointments, creams, lotions, various treatments your physician can prescribe to treat that, and maybe even in some cases to help prevent it from being too extensive. Excuse me. With chemotherapy, there are numerous drugs now that are available to almost obliterate any nausea and episodes of vomiting after the chemo, which is a wonderful thing because that's the thing I think women fear the most. There are drugs like Neupogen and Neulasta to raise your white cell count to help offset that. And then, you know, fatigue is something that is always a byproduct of chemotherapy. It's a profound fatigue that's hard to even describe. It's beyond any tiredness you have ever experienced. But if you follow a high protein diet, which is what my physician recommended, eat enough meats and the foods that have a lot of protein. My husband discovered some great drinks that are organic that have a lot of protein, like 19 grams in a 16-ounce bottle. That's pretty good. Some bars, some, you know, protein bars, things of that nature. So beef up your protein, drink lots of water, at least 3 days before and after chemo. Hydrate yourself with 2 to 3 quarts of water each day, because you want to be hydrated so that this toxic drug doesn't have a profound effect on you or a damaging effect. You minimize that, and then afterwards flush it out of your system. And speaking of flushing, flush the toilet twice so your family's not exposed to the toxic drug that is going to be flushed out of your system and excreted. There are a variety of things available to help you deal with the things that affect the GI tract, because you're going to experience diarrhea, you're going to experience constipation. Get on those immediately so that they don't become extreme or severe. The chemo can also affect your platelets and other things. You will have lab work done before the chemo is given to see what your baseline is and see whether, in fact, you are in shape to have the chemo. They will delay it if your cells are too low and try to build them up. So there are things that are microscopic and things that can be seen by the naked eye that affect you when you're going through chemotherapy. But I want to encourage you and reassure you that there are pretty much treatments available to manage all of these side effects. One thing that I want to mention is the loss of hair. When you have the chemo, it's also going to kill some of the hair follicles, and your hair is going to fall out. Not just the hair on your head, but hair all over your body. You could lose your eyebrows, your eyelashes. I lost all of them. And that's a very upsetting thing for a lot of women, particularly because of the cosmetic effect. But there are scarves, there are wigs, there are a lot of ways to offset that. There are wonderful kits out there with stencils to reapply eyebrows through makeup. I would highly recommend women register with the American Cancer Society. They have a wonderful program called Look Good, Feel Better, and they'll tell you how to even apply some eyeliner in a dot-like fashion to help mimic eyelashes. There's something for everything out there. There are also polar caps that women are starting to use. Well, not starting, they've been using it for a while, but it's becoming more pervasive. It's an ice cap that you put on your scalp, and what it does is it decreases the blood supply to the scalp. So in effect, the chemo is not being absorbed there, and you don't lose your hair. Certain drugs can cause neuropathy. I have neuropathy from chemo where I have some numbness in my fingertips and toes. I have pins and needles. I didn't know this, so I'm passing it on to you. You can wear ice mittens and ice booties, not for the entire duration. You take them off for a few minutes, you put them back on. That has the same effect. It decreases the blood supply to that area. The chemo drug is not absorbed there, so you don't get those side effects. It's incredible, you know, all these things you can do. You just freeze a pair of mittens and a pair of socks and use that. And you can suck on popsicles or chew on ice, and that will also help prevent some of the sores that some women have gotten, lesions in their oral cavity. This, what I'm saying is, there is something to combat nearly every side effect there is if you seek the information.